Eluned Morgan.
Diolch yn fawr, Dirprwy Lywydd. I want to focus my comments in today's debate on setting out the work we're involved with to improve gender identity services for children and young people in Wales, in line with both the LGBTQ Action Plan and the Cass Review. The Cass Review is key to delivering this commitment, and crucially, the Cass Review, which I've read and I welcome, ensures that we take an evidence-based approach to how and when interventions should be made. And I agree with Adam Price, his suggestion that we need to have respect, understanding and compassion for the issues that we're debating in this report. I want to thank Dr Hilary Cass and all those who've participated in the review of gender identity services for children and young people, which was of course focused on services delivered in England. This was a thorough and well-researched review designed to ensure children and young people who are questioning their gender identity or experiencing gender incongruence receive a high standard of care which meets their needs and is safe, holistic and crucially evidence-based. Due to the limited number of children and young people who need referrals to these very specialised services in Wales, like many other highly specialised health services, expert gender identity services are provided by NHS England. I'm pleased to say that our referral pathway in Wales into those English services already aligns with one of the core Cass recommendations, as it includes an assessment by the Child and Adolescent Mental Health Service before a referral is made. NHS Wales has also been working with NHS England as part of the transformation programme for gender services to ensure we are aligned to the Cass recommendations as part of the changes NHS England is making to gender identity services for children and young people. These arrangements will ensure the safety and quality of services to safeguard young people in Wales, which surely has to be at the forefront of our concerns. The transformation programme has set up 2 new children and young people's gender services following the publication of the interim Cass Review in February 2022. They opened last month and will accept referrals from young people from Wales. The waiting list will be managed by the National Referral Support Service. If you don't mind, no, I'm going to persevere. The National Children and Young People's Gender Dysphoria Research Oversight Board has also been set up and is chaired by Sir Simon Wesley to support wider research into children's gender services. The new NHS Wales Joint Commissioning Committee is working with the transformation programme as it moves to the next stages of the delivery plan. This includes supporting the newly opened children and young people's gender services in London and the North West and accelerating work to develop additional regional services and consider how they can be brought closer to home for young people in Wales. And this is delivering on our commitment to review the pathway for children in Wales to access gender identity services. The Cass Review includes recommendations for professional training and a competency framework to be developed, not just for specialist NHS staff working in gender identity services, but for clinicians in secondary, primary and community care. The NHS Wales Joint Commissioning Committee is already working with Health, Education and Improvement Wales to take this forward. So, Dirprwy Lywydd, I now turn to puberty blockers. The Cass Review concluded that there is not enough evidence to support the safety or clinical effectiveness of puberty-suppressing hormones in the treatment of gender dysphoria to make the treatment routinely available. They are not available as a routine commissioning treatment option for children and young people in Wales who are referred via our gender identity services pathway. But NHS England is aiming to open a study into the use of puberty blockers in December to gather further evidence to inform clinical decision-making in the future. Young people who are referred to the services from Wales to England will potentially be eligible to take part in this study. One of the recommendations of the Cass Review, which looks specifically at services for children and young people, was to consider how interventions impact on outcomes. For that to happen, there is a need to monitor the long-term impact through tracking into adult gender services. The Welsh Gender Service, which is based in Cardiff but also has a satellite clinic in North Wales, provides services for people who are 18 and over. This service is commissioned by the NHS Wales Joint Commissioning Committee, and I have instructed it to take on board the recommendations of the Cass report and ensure these adult services are collecting relevant data in a consistent and comprehensive manner to support an evidence-based approach to this issue. While the main focus of the Cass review was clinical services, it includes some important recommendations for other public services, which we will carefully consider in Wales. The Cabinet Secretary for Education has been working on national guidance to support gender questioning and trans learners. She's decided to take more time in the development of this guidance in order to fully consider and be informed by the best available evidence, including the findings of the Cass review and the views of stakeholders. And I know that ensuring the well-being of learners is her key priority. We will publish this important guidance to support schools in line with our commitment to ensure LGBTQ+ inclusive education. The LGBTQ+ Action Plan for Wales sets out our commitment to defend the dignity of trans and non-binary people and to deliver on our goal to make Wales the most LGBTQ+ friendly nation in
Minister,
Europe.
you need to conclude now.
Finally, I think it's important we bear in mind Dr Cass's own words, that the surrounding noise and increasingly toxic, ideological and polarised debate has made the work of the review significantly harder and does nothing to serve the children and young people who may already be subject to significant minority distress. A compassionate and kind society remembers there are real children, young people, families, carers and clinicians behind the headlines. So the Cass report is an important review which must be taken seriously. We want to ensure we provide appropriate and sensitive support to all those young people who are at the heart of the services. It's imperative that we act as a kind society when dealing with these sensitive issues.